15 years ago, we rarely saw kids with juvenile arthritis who complained of severe pain. That has changed. I don't know why. I would say in our clinic, at least a fifth of our patients with juvenile arthritis have this really severe, bad pain to the point that they can't go to school. And 15 years ago, we didn't see that. I worry that some of our technology, as wonderful as it is, has kept our kids from getting out and being active and exercising. We know that about 15 years ago is when physical education classes were being cut from schools. You know, back in the day, I had PE class every day, and now there are some schools where once a week they have PE class. And I just worry that our kids are not getting out, and I think there's something to be said about enjoying some fresh air and getting out there and running and being kids. And kids today, especially at school, they're left inside, they're left to their devices, and there's a balance there. So why we're seeing more and more kids with this severe pain is unclear, but we know that exercise is the #1 intervention to help kids with amplified musculoskeletal pain. There's not a medicine that takes away this type of pain, but if we get these kids up and moving and exercise, it really helps their pain. And so there's something to be said for getting up and moving. So what we know about amplified musculoskeletal pain, you can see the hand, and that's where the injury is. And that black line is a nerve. That nerve goes to the spinal cord. That's what that picture is at the bottom of the figure. The nerve from the spinal cord then goes up to the brain. And one of the functions of the brain is to take in these signals of pain and process the signal. And the brain decides, okay, this is a nerve being triggered that is touching something really hot and can damage the skin, so I need to quickly send a signal to the hand to pull that hand away. Or if it's just a signal where there's not damage, potential for damage, the brain is supposed to send a signal that, yes, this hurts, but it's not gonna hurt you, so we're not gonna have you pull your hand away. Well, what happens in amplified musculoskeletal pain is that signal doesn't go from the spinal cord to the brain for processing. That signal immediately from the spinal cord goes back to the hand as a signal that something potentially harmful is going on, and sends a signal to move the hand and say, ow, that's gonna hurt you, when actually the initial injury is not harmful to the hand. And so you lose this processing in the brain, and kids and adults too, this happens in adults with amplified musculoskeletal pain, have these overactive pain nerves that are firing, and you don't have the processing in the brain that, hey, this is a signal that's not damaging. Because if any of you have kids with this, just to touch them causes severe pain, and light touch shouldn't cause severe pain. Over time, if you have these pain nerves firing, and they shouldn't be, there's less oxygen and more acid in the tissue because overactive pain nerves cause changes in blood flow to that area. So when there's less oxygen, more acid, that just contributes even more to the pain. And as I mentioned before, we've learned that to retrain these pain nerves, exercise is the key. It's the one way to get these pain nerves to send that signal back to the brain and retrain it. So exercise is key. There are some desensitization techniques that can be utilized by occupational and physical therapists. The challenge there is finding an occupational or physical therapist who is familiar with amplified pain and who is familiar with these desensitization techniques. But there are some resources available to physical and occupational therapists for that. Pain psychologists can be tremendously beneficial, although they don't necessarily, the techniques they use don't eliminate the pain. They can really help patients learn how to cope with the pain and various techniques when they're in severe pain to try and minimize the pain. But again, like the medicines, ibuprofen, naproxen, Tylenol, all the various pain medications seem to not help this type of pain. And so really avoiding those medications. And again, it's breaking that cycle of that abnormal nerve to help retrain the nerves.